My name's Alexa. I'm a physician assistant, and I'm going to talk about neuropathy. The nervous system has two main parts. The central nervous system is made up of the brain and spinal cord, while the peripheral nervous system is made up of the nerves that exit the spine and go throughout the limbs in the body. The peripheral nerves pass signals to and from the central nervous system and the rest of the body. A neuron is made up of several parts, including dendrites, a cell body, and an elongated axon. Nerves communicate via neurotransmitters, which are released at the synaptic terminal. This is where two nerves meet. A nerve is composed of a bundle of axons. Most nerves are enveloped by varying types and thicknesses of an insulating material known as myelin sheath. This helps nerve impulses travel faster throughout the body. Neuropathy is a general term which refers to any type of nerve damage. Mononeuropathy refers to damage of a single nerve, typically due to compression of the nerve from an anatomic structure. An example of this is carpal tunnel. Radiculopathy refers to compression of a single nerve root within the spine. Polyneuropathy refers to damage of multiple nerves and is often therefore a sign of a generalized, systemic, toxic, or metabolic problem. There are two main nerve types affected, including motor nerves, which control the muscles of the body, and sensory nerves, which allow us to feel things, such as temperature, texture, vibration, and allow us to distinguish objects by feel. There are many causes of polyneuropathy. Some of the most common we see in patients include vitamin deficiency, diabetes, poor circulation in the extremities, exposure to chemotherapy or radiation, autoimmune diseases, and exposure to toxins. While these are amongst the most common causes of neuropathy, it can also be idiopathic, meaning there is no identifiable cause. Common symptoms of polyneuropathy include numbness and tingling in the hands or feet, which is known as a paresthesia. Patients can also have burning or pinprick sensations in the extremities. When symptoms occur in both the hands and the feet, it is referred to as a stocking-glove distribution. In more advanced cases of polyneuropathy, the motor nerves can become affected, which can result in muscle weakness and eventual shrinkage or atrophy of the muscle. The diagnosis of polyneuropathy begins with a physical exam. A patient's ability to feel different sensations, including light touch, temperature, and vibration, are recorded. If these are decreased, it could be a sign of polyneuropathy. Patient deep tendon reflexes are also examined for strength of response. If they are deemed underactive, this could indicate a peripheral nerve issue such as neuropathy. An electromyography test and nerve conduction study is the confirmatory testing for the diagnosis of polyneuropathy. There can be a patient concern that this test may be painful as it involves small shocks to the skin as well as needles. However, the shocks provided to the skin are like to that of carpet static, and the needles utilized are single-use, Teflon-coated, non-stick type needles which are equivalent to the size of an acupuncture needle. A cooling spray can also be topically applied to the skin to ease any discomfort. This test involves measuring the functional ability of the motor and sensory nerves. It can also identify the presence of radiculopathy. In this case, an MRI of the spine is obtained to further assess the area of concern, and if there are signs of significant deinnervation, a surgical resolution is often required. If the EMG findings are consistent with neuropathy, a panel of lab work is ordered to identify a potential cause of the nerve damage, further helping to guide treatment and in hopes to prevent further progression of symptoms. Although some causes of polyneuropathy are curable if caught early on, there are several medication options available to treat the painful associated symptoms of this condition.